The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
A hospital is home to heroes, but it also needs a champion. Someone who can defend its heroes by keeping care competitive as more patients go digital and new players compete for patience and loyalty. Xealth helps you be the champion by giving your team complete control over all things digital. With Xealth, doctors can order, deliver, and monitor care from one unified platform embedded within your existing EHR. And Xealth puts you in control with a digital command center and the big picture data you need to back up smart decisions so you can achieve your clinical, financial, and strategic goals. Xealth is already making digital health a competitive asset for hundreds of hospitals and thousands of providers. Be the champion for your hospital. Talk with us today and learn how Xealth can help you shape your digital health future.
Over 3,000 acute care hospitals and thousands more ambulatory, behavioral health, and value-based care organizations have implemented Collective Medical. One example of an integrated workflow is Collective's ability to surface synthesized content to the point of care within a hospital. The ED trackboard representation here shows that for every patient presenting to the hospital, Collective is able to analyze at the onset of that visit if a patient presents with clinical insights from other providers or presents with certain risk factors that have been identified from prior hospital encounters. For example, high utilization trends, presenting to multiple EDs in a short period of time, safety and security alerts, history of multi-drug resistant organisms, and many more. In addition to sending collective notifications to the hospital, Collective Medical has deployed a true bidirectional solution through Smart on Fire. This native integration allows providers access to patient data gathered from across the network, as well as the ability to input care insights that are pushed back to Collective, removing the need for providers to exit the EHR and log into a third-party solution. This allows providers and clinicians to communicate information more effectively on patients to other healthcare organizations in the community without ever navigating away from their EHR.
This is Mandara Singh, the Senior Vice President of Collective Medical. I wanted to start by saying thank you to the judges for nominating us in the EHR Innovation Best in Class category. I'm here to tell you a little bit more about Collective Medical. As I think about the components of what it takes to drive better outcomes, at Collective Medical, we really think about it in three categories. You have data, so our ability to aggregate data across multiple points of care, thousands of hospitals. But then it's really what you do with that data that makes a difference. How you derive data or collect user-generated insight within the workflow means that providers don't have to swivel chair to understand what's important about their patients. And it means that every stakeholder in that patient's health knows that when they put an insight into our platform, it is reaching a provider who is truly engaged in that patient's health and is able to understand that information. So today, across thousands of hospitals, we integrate with provider workflow and care workflow so that these entities and these stakeholders in a patient's health can not only understand from our network what's relevant to the patient in front of them, but can share that information that they have that may be unique to their experience with the patient across a vast network of other providers who are also stakeholders in that same patient's health. When you put this all together, the result of this care coordination has significant impact. First and foremost, on the lives of those vulnerable patients that we help these stakeholders coordinate around, to ensure that these patients don't fall through the cracks and that the next provider they see has a comprehensive view of what might drive the best next step for this patient. But the impact to these providers is also significant. And so as we look at these numbers, they're pretty meaningful in terms of driving down the cost of overall care, driving down avoidable visits to the hospital, and overall helping our healthcare system work more efficiently and more in service of the patients who need us the most.
Diameter Health is a mission-driven organization that has as a mission the goal of making data universally accessible, organized, and actionable for better health and a more efficient healthcare system. We have a core API technology that normalizes, enriches, and aggregates multi-format clinical data with speed and scale, allowing us to generate high-quality data as an asset that has tremendous impact on patient and population-level care. We're comprised of seasoned entrepreneurs and operators with substantial healthcare and clinical informatics backgrounds, as well as being backed by premier healthcare venture capital organizations. Our work sees us processing 2 million clinical documents with breakneck speed daily for just one client and generating 6 billion FHIR resources in 3 months for another. Our 5-step data improvement process, known as Fusion, improves the data and its usability. To improve interoperability, we were laser focused on semantic normalization to national coding standards like ICD-10, LOINC, and SNOMED. We enrich data with key pieces of metadata that help providers gain individual patient and population level insights. We reorganize clinical data so that it exists in correct sections of the medical record. Lastly, we deduplicate repeated chart elements intelligently and generate a comprehensive and longitudinal patient summary. This data can be served in a myriad of ways, be it CCD, FHIR, or in tabular form. Our data quality insights also provide healthcare organizations with document syntax and completeness grading at the organizational or data provider level, EHR level, provider level, or patient level. Like the ocean, our healthcare system has enormous potential, and this potential is packed in the insights and opportunities that exist in its expanding body of clinical data. Unlocking these insights and opportunities through upcycling transforms potential into power for payers, provider, government organizations, but most importantly for patients and their families.
I serve patients every day in my clinic, but the tricky balance is also serving my patients who are waiting at home. Renewals in my EMR aren't hard per se, but they do require a lot more clicks and keystrokes than I would like, as I'm basically serving as a transcriptionist for my own system. You see, the pharmacy sends patient directions for Joanna Smith, like you see in the yellow bar, take 1 tablet by mouth every day. But that exact phrase is derived from the pharmacy's computer system. For my EHR to perform safety checks, I need to transcribe the same set of instructions into terms my EHR uses. I do this through a series of painfully obvious clicks and keystrokes before I can hit accept, so Joanna's pharmacy can proceed. I'll be honest, because all these clicks and keystrokes are hard to manage at the same time I'm taking care of patients in my office, I tend to wait until I have enough time to process them all as a batch, which sometimes means the patients waiting for these refills can be waiting for a while. With Smart Renewal by Dr. First, for patients, the fields I used to fill in manually are completed for me by the artificial intelligence, and my job is simply to verify everything is correct before I hit accept. This makes it faster for me as a doctor, and downstream, faster for my patients. At Dr. First, we really focus on big data as it relates to medications. So the role that medication data can play in patient outcomes, in efficiency, in patient safety. And one of my roles as the Chief Medical Officer is to lead up our Applied Clinical Research Division. Mm-hmm. And so we are actually now at the stage of using real-world data with our partner clients to measure the impact that our solutions are able to make specific to medication management, whether it's improvement in MedRec, whether it's improvement in efficiencies or FTEs, and even things like reductions in adverse drug events or safety events that actually reach the patient. It's pretty powerful. One of the things that we've noticed and that we've really put a laser focus on as a company is making sure that data is appropriately structured. Mm-hmm. So there's actually a dirty...
Like from the get-go.
From the get-go. Mm-hmm. So structured on the way out the door as an e-prescription, but also, believe it or not, along the way, that data loses its structure, whether it's because the dispensing pharmacy has to rekey it in, whether the instructions or the SIG for the prescription actually are free text. We actually have innovative solutions that can turn all of that back into structure so that you can use it meaningfully, whether it's for MedRec, whether it's for data analysis. And again, this all has a downstream impact on things like patient safety and efficiency.
Healthcare is at the brink of a massive transformation. Over the last 10 years, the industry has spent billions of dollars in digitizing healthcare processes with great success. That was step number one of the journey. Now, we have troves of information on our health locked in electronic silos. Without a complete patient picture, gaps in care, gaps in communication, medication use, referrals, and the entire care experience can fall apart. We need to bring this information together using a cloud platform that not only unlocks the power of the data, but also provides a platform on which new digital services and solutions can be built with native interoperability. And this is where Innovacer comes in. With the Innovacer Health Cloud, we deliver the missing pieces required to build the future of health, including a cloud-native data activation platform that acquires, aggregates, and normalizes clinical, claims, lab, and other healthcare data across systems and settings, giving providers and other stakeholders a 360-degree view of patients and their care journey.
Healthcare data models are broken, keeping vital information siloed across the digital ecosystem. A breakthrough is needed. That's why the Innovacer Health Cloud is accelerating innovation of healthcare, and it's all powered by our best-in-class data activation platform.
We are building a platform. A lot of different people can basically come and really start building new tools and technologies for caregivers, for patients, for everyone who is in the continuum of care.
This platform brings together multiple data sources to create a unified patient record, leveraging plug-and-play data integration pre-built for most health IT systems and vendors.
Innovacer has been able to create what I would call liquidity of healthcare data.
Innovacer is able to aggregate the claims data and process it immediately and make it available to the physician with the patient and the patient's family in front of the physician, and not only have it available, but have it put onto the same screen that the physician is looking at the time he's looking at the healthcare delivery data.
Innovacer moves beyond silos to create a completely open and secure platform, connecting and curating the world's healthcare data.
We have one platform that's meeting the needs of what required 3 or 4 platforms previously.
It's constant evolution because we're learning new things every day that we didn't know before, because now we have the data.
Experience the data activation platform that is accelerating innovation in healthcare at innovacer.com.
ThedaCare is transforming their health system into a population health company under the leadership of their CEO, Dr. Imran Andrabi. Heavily focused on accountable care, ThedaCare launched the Be Well solution under the brand Ripple, with a goal to automate care gap closure across their population of patients. Consumer activation workflows transform care by integrating consumer health data from both the health system and from outside providers, and combining it into one comprehensive but easy to understand view. Providing a health summary with well-defined care needs and next best actions. Leveraging analytics that trigger personalized engagement workflows that drive consumers to close specific gaps in care. And simple navigation to the most appropriate care setting, whether it's virtual, in-person, or digital therapeutics.
BeWell's superpower is our relentless commitment to simplifying healthcare experiences for consumers, while also delivering value to our customers in their journey towards value-based care. We bring together a diverse workforce so that our platform will consistently represent all people. We're built on a foundation of real-time data authorized by consumers and integrated bidirectionally into today's core workflow systems, like EMRs and payer systems. Our configurable workflows leverage this data and empower clients to deliver personalized messaging all the way down to an N of 1, without having to use our most precious resources, our doctors and our nurses, to pick up the phone. And our open API framework has the ability for fast auto onboarding of solution partners, with recommendations to consumers to provide support in between doctors' visits. I believe we should win the UCSF Health Award because the future of health is collaborative, and it's going to require companies of all kinds to work together to deliver a combination of care that is in person, virtual, and digital. And it's going to require delivery of an all-in-one healthcare experience that consumers can trust. We offer the missing layer of infrastructure that makes this future a reality.
The current state of the payer-provider relationship is costing the healthcare industry billions of dollars, but it does not have to continue. By eliminating administrative burden and processes that do not foster collaboration, payers and providers can finally achieve their common goal to improve outcomes for patients. The discipline of utilization review is a good place to start. The UR process hasn't been served by technology. It has been largely subjective and contentious, and it leads to conflict amongst insurers and the providers of care. But Exelis clients are ushering in a new future, one that is centered on technology, focused on the member, and collaborative across the continuum of care. Exelis acts as the bridge between payer and provider. How? By using objective, real-time technology and artificial intelligence to help both parties speak the same language and work from the same playbook.
The administrative burden of healthcare is crippling. At Exelis, we see utilization management as one of the most underserved and underappreciated areas of healthcare, responsible for making sure care is appropriate and costs are right. Yet the current process is mired down in administrative work that keeps nurses and doctors from operating at the top of their license. We're working to remove that burden through technology and refocus their care towards the patient. You've heard all the industry buzzwords: artificial intelligence, machine learning, natural language processing, deep learning. But despite all the buzz, are they helping you? We offer the power of these technologies in a software platform that gives utilization management staff a single, real-time source of truth of what's going on with each patient, helping you to do your job faster, easier, and more accurately.
Joan Butters, CEO and co-founder of Exelis here. I formed Exelis in 2013 because I saw the need to bridge the information silos that exist between healthcare providers, payers, and patients. We've built a solution before the market knew they even needed it, and doing it with artificial intelligence before it even became widely used, let alone in healthcare. Today, our technology and services address the hundreds of billions of dollars in administrative waste in our U.S. healthcare system head on. We are leading the industry with data and artificial intelligence to reduce administrative burden and increase the focus on patient care, to leverage the objective truth in data to achieve true collaboration between payers and providers.
Omni is a new kind of site search that answers a customer's need, a want, or simply a question, and delivers the right care quickly and without frustration. It's easy to install, customizable, and provides customers with access to care from a single search bar located on any page. Omni fetches all your website's data and content and makes it indexable and searchable. As you update the site, Omni updates search results automatically. Finally, modern search has arrived to healthcare. Search literally anything and deliver a search experience that never leads to dead ends and keeps customers engaged. Search results are dynamic, personalized, relevant, and organized by providers with next available appointment or a location with same-day availability. Healthcare websites are dependably complex, as your customers must sift through an amazing number of options to find what they're looking for. Done right, Omni works like magic to pair customers with the right care. Search for providers, locations, and conditions. No matter the query, with just a click, Omni interprets intent and returns the care, the modality, and the experience that your customers want.
DexCare is a platform for patient access, and one of the things that we pride ourselves in is making sure that we meet patients where they need to be met. Search engine where they start their search. We know that health system patients are not necessarily monogamous to their health system, especially when it comes to convenient care. So they usually start at something like Google or some other search engine, in which that we want to make a health system as performant as possible at the real front door at Google, using SEO and SEM strategies, as well as giving tools to the health system to be able to manage their ad spend and campaigns based off of their real capacity. So, for example, one thing that we can do is take the inventory data that we have, capacity data that we have, when we connect into your EMR, and pull out that inventory for specific clinics or specific providers, that we can actually pause ad spend based off the inventory. So if right now a clinic was low on slots, then we can hide that ad and pause that ad so you're not spending money on an advertising or getting pay for click when really there's no inventory to be sold. So one of the things that we do here is also make sure the health systems are set up from a Google My Business perspective very well, and they are one click away from Google. Every patient is one click away from Google to an ability to transact, and it can convert down the system. So for example, a patient here typed in urgent care or symptoms around urgent care, in which that they are presented with an ad, and then also some locations, and proximity usually wins when it comes down to healthcare locations. So we want to make sure that our virtual service has also got a GMB location within every area as well, so it can compete and be presented next to actual physical locations. And then we also have the traditional organic SEO results.
Hospitals understand the importance of providing high-quality patient care, but achieving this level of care is not possible without nurse rounding. Many organizations struggle to find a consistent and efficient rounding process. The traditional pen and paper approach to rounding often leads to inconsistent information, unresolved issues, and wasted time. To address these challenges, nurse leaders must utilize technology to improve the process. CypherRounds, Cypher Health's digital rounding technology, is designed to streamline the rounding process. CypherRound scripts, alerts, and reports are customized to your needs to easily collect and analyze information gathered during rounds. Its easy-to-use interface features automatic alerts and real-time reports to ensure staff accountability and quick issue resolution. Ultimately, these improvements lead to increased patient satisfaction and higher HCAHPS scores. The best part? Our dedicated support team is there to help you achieve your goals. Our results continue to showcase how digital rounding achieves high quality and patient-centered care. See how we can help enhance your rounding today. Cypher Health, the patient engagement company.
First thing she does is review those current medications with Lucy. And she starts with the Levemir, and they have a conversation about, what would work for Lucy. They decide to go with the Lantus, and you can see that a PA is required. So in selecting the Lantus, we're going to power an EPA experience that immediately pulls back the question set required to get approval to Lantus. So Dr. Raja can go through, answer the questions, digitally sign, and submit that through in real time. When it can be approved, the answer or the approval will also come back in near real time. And so in this case, we got approval, everything's good to go. And if for some reason there was a denial, it would, go off to the care team for further processing. So Lucy's all set to get her now Lantus with that PA covered. She also decided she did want to go downstairs to that health system pharmacy instead of her usual Walgreens. And so Dr. Raj is also going to go in and make that change on her Lysina Pro.
Clinical decision-making has been disconnected from consumer choice. Purchasing decisions are made on behalf of patients without the ability to consider the most affordable or accessible option. That may have been okay when deductibles were low, formularies were simple, and the variability in drug pricing was in the tens of dollars. That's no longer the case. Deductibles are in the thousands. Patients bear the whole cost within those deductibles. Formularies are complex, and drug costs may vary hundreds and sometimes thousands of dollars. At Arrive Health, we're clearing the way for better health. That means enabling consumer choice, affordability, and access within the ordering workflows of providers. That also means empowering patients and their care teams to leverage real-time and patient-specific affordability options. We're approaching a run rate that will result in 100 million transactions a year. We have 150 million health plan members accessible in our network and more than 300,000 providers addressable in our network. We've established ourselves as a leader in point-of-care price transparency, but we're just getting started. Arrive Health is born out of the belief that all people deserve access to affordable and quality care, that no one should have to choose between managing their health and meeting their basic needs. Arrive Health's unwavering focus is to solve patient affordability issues, guide patients down a care path that results in less friction and lower overall costs, and empower providers and their care teams to be a part of that process from the outset. This all starts with the trust that exists between the patient and the provider. Empowering that inherent trust with the right information at the right time is how we are connecting consumer choice and clinical decision-making for the first time.
Welcome to Augmetics, offering the most effective way for clinicians to reduce time spent on documentation tasks, improve daily productivity, and prioritize patient care. How does it work? It's simple. Clinicians log into the HIPAA-secured Augmetics service platform using a dedicated device that stays with the clinician throughout the day. The Augmetics service platform leverages intelligent automation technology to efficiently deliver accurate medical notes. The service is overseen by medical data specialists to ensure quality. At the core of the Augmetics platform is the proprietary Note Builder tool which incorporates automatic speech recognition and natural language processing. Note Builder does the heavy lifting when it comes to constructing patient notes. What is most important to clinicians is that the Augmetics service enables them to have a completely natural, unconstrained conversation with their patients.
We find ourselves at a juncture in the industry where there's a confluence of forces that are demanding the services that we provide to the industry. That is a chronic shortage of healthcare professionals and an increasing demand for the services that they provide. When the company was founded in 2013, our ambition was to develop a technology platform that could generate complex medical notes on a fully automated basis, on the basis of natural conversations between doctors and patients. This platform has been under development for quite some time and is being launched in phases, allowing us to automate key steps along the way until in the end, the entire note will be automated. Our ambient automation platform utilizes a combination of structured data models, machine learning, and natural language processing to deliver comprehensive medical notes to more than 35 specialties across a variety of healthcare settings. This is having a profound impact on the industry, as it is relieving doctors from 3 hours of documentation work every day, thereby boosting their capacity to see more patients and at the same time improving their work-life satisfaction. Our solution today is trusted by 4 of the top 10 and 6 of the top 20 U.S. healthcare enterprises and hundreds of physician practices across the U.S. I am very fortunate to work with such a great team of individuals who are passionate about our vision and dedicated to the success of our customers, our shareholders, and each other. We are motivated by the knowledge that what we are doing really makes a difference in the lives of overburdened physicians.
VIM Connect is a point-of-care connection platform for U.S. healthcare that connects external data to existing workflows directly in provider EHRs. This is VIM Connect's suite of provider engagement solutions. VIM Connect is a context-aware, EHR-agnostic solution, meaning it can recognize when a relevant patient is in workflow and it can scale across diverse EHRs. This video highlights a few of our innovative solutions. Eligibility for patient benefit confirmation without spreadsheets, phone calls, or portals. Patient health history that delivers claims-based data summaries to take the guesswork out of a patient's health journey. Diagnosis gaps that embed suspected diagnoses within EHR workflows and provides a revolutionary way for our providers to address and accurately capture gaps with our EHR Write Back feature. And finally, Order Assist, which helps care teams select high-performing in-network referral destinations. Thank you for taking a look at how VIM is powering the future of healthcare.
Hi, UCSF Health Hub judges. My name is Jonas Goldstein. I'm the Vice President of Commercial and Strategy at VIM. Thanks so much for your consideration for the Digital Health Awards in 2022. VIM is a point-of-care connection platform. We are a technology company that connects data to workflow within existing EHR interfaces for provider organizations around the country. Our customers are health plans, risk-bearing entities, and provider organizations themselves. Anyone who seeks to take content that really ought to be in workflow, but today requires a bunch of clicks and hunting and gathering to get to, and creates a lot of burden for providers. And we put that directly into EHRs and with read and write access across workflows. We're highly scalable. We can deploy in often less than 15 minutes to get a new clinic started. That allows us to bring on at least 75 new provider organizations a month across the last quarter. And it also has allowed us to achieve a big milestone recently of 500 provider organizations connected to VIM. Once we're embedded, we can read and write in very flexible ways, which is different from alternatives. We can recognize context and say when a provider is opening up a referral, we can suggest a higher value option or spotlight a quality and care gap during a visit workflow in ways that are seamless and easy to use and drive really high engagement rates. We are in use today by 2 of the largest 3 health plans in the country, as well as some of the biggest names and risk-bearing organizations around the nation. We have a large and growing footprint. We are live in the field on 5 product applications that sit on top of our platform today and driving thousands and thousands of transactions that are saving providers time and accelerating the pathway to value-based care. Our team is spread across the US. We have a technology hub in Tel Aviv, Israel, and our commercial team consists of experts in value-based care and healthcare delivery. So thanks again for your consideration, and we look forward to hearing your feedback and hopefully proceeding to next steps.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.